yeah, I'll work overtime. Oh, you want me on that committee? Sure, I'll be on that committee. And I just said yes to everything, thinking that was like the best way to launch me into my career and to like connect with my coworkers and to be a good nurse and be a good helper. This is not what I've seen on TV. I want to take care of these COVID patients myself. I want to say, I am the nurse caring for you today. I will be here for you and your loved one. Like, I want to be the nurse. Yeah, that was really hard. I didn't like how that went. And just like take time to process the hard stuff. Saying yes to everything means that you're saying no to something else.
All right. Well, here we are. Welcome to the Investing RN podcast. Today we're joined by Sarah Lorenzini out of Florida, sunny Florida. I'm sure that's nice right now compared to what Josh and I are dealing with. Josh is probably worse. He's in northern Wisconsin.
It snowed yesterday.
Yeah, so there you go. It rained here and it drops down to like low 40s at night, but all in all, not too bad. But we're excited to have you on. Kind of a little different twist. I mean, I guess not. You have a side hustle, so it's not a different twist at all. But it's kind of cool to talk to another podcaster, and we're chopping it up before the show started. But yeah, welcome to the show.
Thank you. So glad to be here.
Yeah. So we like to start off just kind of getting a little background, and I think for you, it sounds like there might have been an exact moment that you knew you were going to be a nurse. So tell us about that.
Yeah. So I've always been that person that's like, when I grow up, I want to help people. And I thought that was going to be being a doctor because I see doctors helping people on TV, and that's like exactly what I wanted to do. And so in high school, I volunteered in the hospital to like see some doctors in action. And basically they put you with the nurses. No one's going to like let you go hang out with the doctors and do stuff. So I'm with the nurses and I'm starting to realize, wow, these nurses, they actually know more than like how to wipe butts. This is pretty impressive how much knowledge they have about medications and about these diagnoses of the patients. And I remember one day in my naivete asking the nurse, so when do the doctors like come and like do the stuff for the patients? Like when are the doctors like teaching them about their diagnosis and giving them their medicines and like changing their dressings? And like when are the doctors coming to do that? And she was like, sweetheart, the doctors already came and went. They have like 30 patients they have to see. By the time you get here, they've already left this floor. The nurses do all that. And I was like, what? I've been lied to by the media. This is not what I've seen on TV. And so that's when I started thinking, like, do I actually want to be a doctor? I know I want to help people, and doctors help people, but I want to do the things that helps the people. I want to give the medicine. I want to explain the diagnosis and the procedure and like calm their fears and walk them through this journey. I don't want to have 30 patients. That sounds, how would you even know their names with 30 patients? So that's when I started the idea of like, maybe, even though I always told myself and told everyone else I'm going to be a doctor one day, and they're like, oh yeah, of course you will. You're so smart, Sarah. Maybe I actually want to be a nurse. And so I kind of shifted my gears to nursing school. Never thought I'd be an ER nurse or a rapid response nurse, but here I am. I've been a nurse for 20 years and I still love it. And I love the physician colleagues I get to work alongside. I think their role is very important, but the way that I am wired, nursing is a great fit for the way God made me. So that's my story.
It sounds like you were watching Grey's Anatomy.
Not back then. Remember, I graduated nursing school in 2004. So no, this is pre-Grey's Anatomy.
What was it then?
This
was
is
it
like the
ER?
90s. Yeah, ER. There's a lot of medical TV dramas that were more like love stories or like love drama stories. That's kind of what I had seen. So yeah, I was very misinformed of what it was actually like to be a nurse.
Equally as inaccurate as Grey's Anatomy is.
Right.
George
Exactly.
Clooney will make anybody want to be a doctor though. So I
for sure.
can't blame you for that. Yeah, but it is interesting. It's like a lot of people will ask like, oh, is it just like Grey's Anatomy? And I'm like, no, dude. Mm-mm. Doctors, no hate on doctors. I love doctors. I think they're, like you said, equally important or more. I don't know, whatever. They're important.
But I'll play a role in the patient's care.
Yeah, exactly. Yeah. But it's like, they're not doing chest compressions. They're not bagging the patient. They're not starting IVs. So it's just funny to see people that like, that's their perception of what the hospital's like. Yeah. But so that was kind of the, I guess, like light bulb moment for you where you realized, not doctor, you want to be a nurse. So then what did that process look like? And then you said you were surprised to find your way into ER. What did you think you were going to end up in, and how did you end up in ER?
Yeah, so I love children. I have 5 of them, actually. That's how much I love children. And I thought I'd do pediatrics or like labor and delivery or something along those lines. But in nursing school, which I started nursing school at the ripe old age of 17, and I graduated at 19 because of dual enrollment. Again, I knew what I wanted to do, so let's just like knock this thing out and get it done. So in nursing school, I thought I would get a job in the ER just so I could see everything. I thought it would help me academically to see all the different diagnoses and all the different patient populations. And it absolutely did. And I also fell in love with taking care of patients on the worst day of their life, taking care of patients and families who are in crisis. And I found that I'm actually pretty good at this. That people told me, "You've been so comforting. We've so appreciated having you here. Thank you." And I was like, man, I thought I would be with people, earlier in life or like, the day your baby's born, but maybe I would be really good at being with someone on the day they pass as well and walking families through that. So I became an ER nurse straight out of nursing school. This was pre like new grad, what do they call them, like externships. I did not have an ER educator. My orientation was like 4 weeks long and they just threw me to the wolves. But I figured it out. There's a lot of things I did wrong that I learned to do better eventually, but I love the ER. Ultimately, I went CVICU and then rapid response nursing. I love teaching nursing. So then I went and got my master's degree in nursing education. I was a nursing professor for a whopping 1 year. I love the students and I love teaching. I wasn't quite ready for like office hours and faculty meetings. Not my vibe. And so then I was the ER nurse educator for 5 years. That was a great like combination role, get to be at the bedside and teaching nursing. And then COVID hit, and that's when I was like, that's it. I'm done teaching donning and doffing of PPE. I want to take care of these COVID patients myself. I want to say, I am the nurse caring for you today. I will be here for you and your loved one. Like, I want to be the nurse. And so I started the rapid response team at my hospital, and I've been doing rapid response ever since. So 4 years now, I've been the supervisor and lead on the rapid response team. But then when I was no longer like educator on my badge, I still had it running through my veins. It's like, man, I still want to do something to give back to the profession. Like, I still want to teach. I don't have time to be a professor, but I still like teaching a lot. And my husband was the one that was like, why don't you start a podcast? You listen to hours and hours of nursing podcasts or, medical podcasts. Usually it's like physicians or paramedics or whatever. You listen to so many. Why don't you just start a podcast? At which I laughed because anyone who knows me knows I am so not tech savvy. Like, it's really bad, my inability to use like my iPhone. Like, it's terrible. But I sat with it, let it roll around my head. I was like, you know what? I'm gonna try. I'm gonna start a podcast. And then in the podcast, I can share, real life stories of patients I've encountered, obviously HIPAA appropriate. And then from the story, like use that to break down the pathophysiology and the pharmacology and the nurse's role. I'm going to do this so I can help the nurses that I work with, because there's not always time to go into depth and teach after like, a rapid response emergency. So I started it just thinking it would be like for a local support of my fellow colleagues, and it blew up. And so here we are almost 4 years later, and the podcast gets like 45,000 downloads a month. So nurses that I could have never met, never touched, never got to teach in person, I get to teach them through the platform of podcast. It still makes me laugh a little bit because I started in a closet and now I have like an actual like recording studio in my house. But it's so rewarding. I love having the podcast. For me, like whenever nurses message me and say, hey, I want you to know I listened to episode 38 and I had that same patient and then I knew exactly what to do. Like, thank you so much. I walked into it confidently and I saved a life because I knew what to do about that random weird emergency that you talked about in that episode. So that makes it all worth it. I really enjoy it.
So you said that in 2020 COVID hit, it brought you back to the bedside. I feel like that's very counterintuitive because 2020 definitely pushed a lot of nurses out of the bedside. So what is it about you that wanted to come back in and I guess help out, or what was that feeling when that made you want to go back?
I've always seen nursing as a calling and not just a job. And it is a job. Like, I got bills to pay, I got kids to feed. Like, it is a job. I don't volunteer to do it for free. But I just felt like there was an extra need for nurses that are wired the way that I am to be able to step in when things are horrible and intervene. So I don't know. I've always just been the person like runs towards the fire. I commonly say like, I love a challenge. Let's do this. Like, that's just the way that I'm wired. And so it just seemed like not the best use of my skill set to be just, this sounds so bad. I don't want to say just educating, but just being the educator role when I had all this like desire to jump in and be a part of caring for people, caring for our country when everyone's just in chaos and in crisis. I want to use my skills to care for those patients and to come alongside my colleagues who are in the trenches doing this and like drowning. I want to support them as well. So that's when I decided to make the shift. But yes, burnout is a real thing, and I definitely came very close to it multiple times in my career, especially at the height of COVID. Um, but for me, I think because it always has been a calling and not just an income provider, that's what keeps me like running towards the fire and not like away from the challenge of it all.
Where were you during COVID? Like what state?
In Florida. So yeah,
And
we definitely got hit pretty,
well, that's what I
pretty
was gonna
hard.
say, because you guys got hit pretty hard. Did you see a lot of other people headed in the opposite direction during that time?
Absolutely. Oh yeah. So many nurses that I had worked alongside for years that I still think are stellar nurses left the bedside because it was just such moral injury, and they just saw so much suffering and so much sadness, and it was just so heavy. So it wasn't nurses leaving the bedside that I was like, oh yeah, they probably shouldn't be in nursing. No, it was a lot of nurses that I think were amazing that I looked up to that ended up leaving the profession. And and when I talk to them and hear their stories, I totally understand because I experienced the same things, and I felt that like, I can't take this anymore. I don't want to do this anymore feeling. I felt that too. But there's lots of, when COVID hit, I'd been a nurse for 16, 15 or 16 years. So there are a lot of things that I had put in place to take care of myself so that I could continue caring for the patients. I think about all the new grads that entered nursing around that time frame. I don't know how they were able to learn how to be a nurse while also just being surrounded with such tragedy and suffering and pain and fear. Like I can't imagine being a new grad in that season. But again, for me, all the more reason to jump in and help because we need the new grads to stay at the bedside too. So yeah, I think that I had learned strategies to help me get through that time. And that's how I was able to still keep caring for patients, even though it was especially hard during that season.
Yeah, I think it was interesting because there was a combination of like seasoned nurses that were maybe just waiting around thinking about retiring that left,
Mm-hmm.
but then there were a pretty good amount of new grads that kind of came in and were just like, nope, this is not for me, and left. And it's crazy to think that, hey, after going through all that nursing school, now you get this new job and then you get thrown into that and you're just out. Like I don't know what all those people did.
Even like when we came into the fields, like there was a lot of things that were different from the expectation. So I can't even imagine coming in 2020 as a new grad, like, oh, this is definitely not what I signed up for, and turn around and leave.
You mentioned that you had some like techniques or things in place to prevent burnout. What were some of those things?
It's a lot of things, honestly. All of them learned from like trial and error. I think my first couple years as a nurse, I was not good at setting boundaries and saying no. I was 19 years old, and all my colleagues are much older and much cooler than me. And so when they asked me to do something, I was like, yes, yeah, I'll work overtime. Oh, you want me on that committee? Sure, I'll be on that committee. Oh, you want me to do that? Yeah, I can do that. I can. And I would just said yes to everything, thinking that was like the best way to launch me into my career and to like connect with my coworkers and to be a good nurse and to be a good helper. But I think saying yes to everything means that you're saying no to something else. And sometimes that's saying no to your family or saying no to your own, personal health and well-being. So I think I had learned to say no earlier on. And if I was a new grad in that, I can't imagine. I would just work constantly. So learning to say no, having good boundaries. I think too, I learned the value of operating from a place of wholeness and not a place of like scraping the bottom of the barrel. I remember my first couple years. I mean, I was also young. Like my frontal lobe wasn't fully developed, y'all. I never packed a lunch for work. It was like I would eat the saltine crackers and peanut butter and chug a chocolate milk and just keep going, right? I didn't take breaks like I should. I didn't sleep well. I worked night shift, so I would like get off my shift and then go hang out with my friends that were going to the springs and just not sleep altogether. Like all these things that I did because I was young and dumb. That sounds terrible, but I really was. That would not have served me well at the height of COVID. And so, learning to find ways to fill my cup so that I have something to pour out to patients. I can see in myself when I'm operating from a place of not wholeness, whenever I'm running on empty, I'm a little more snippy with people. I have less patience. I don't have compassion just bubbling out of me. I'm like scraping to find compassion for some humans. Like when I'm in those moments, I am not a good nurse. I mean, I can do the job, I can do the task, but I'm not able to like really embody the kind of nurse that I want to be. And so I think I've learned early on, and I remember doing this activity okay, if I'm pouring out, constantly emptying myself for others, not just as a nurse, but as a mother, as a wife, as a friend, as a sister, constantly pouring out. So what am I doing to fill that cup up so I have something to pour out? And I actually made a list. I still have it on a piece of teal paper. I still keep it with me, of all the things that fill me up. And it's not like your classic things. Like sometimes it's just being in a hammock or being close to a body of water or snuggling babies or sitting by a fireplace, which I live in Florida. I only get a couple times a year I get to do that. Like whatever the thing is that fills your cup, and it's different, board games or taking a walk or like a long bath, whatever the things are. I mean, a list of things that fill my cup, and also a list of things that I know just suck the life out of me. Like ungrateful patients, toxic coworkers, that boss that just doesn't know how to lead well. Like that just sucks it out of me, drains me dry. It's like, okay, if I know those things are going to be in my life, I can't avoid them. I still have patients to care for that are going to be difficult. I still have that toxic coworker that's going to be there when I show up tomorrow. So let me make sure I'm putting in my calendar things that fill my cup, like making space for those. So when I get my work calendar, okay, these are my 312s, but where can I fit in a chance to go be in a hammock? Where can I fit in time to do yoga? Where can I fit in time to snuggle with my kids or to be silly or whatever the thing is that like gives me life? I need to make sure I'm making space for those so that I still have the capacity to care for literal hundreds of humans that are dying at the hospital and their loved ones, and be able to continue facing that from a place of wholeness, not a place of emptiness. So filling my cup was another one. What else? I learned to celebrate my wins and not just like move on past them. So like when something went well, I got a certification, I passed this course, I now can take care of ECMO patients or whatever the thing is, like to celebrate it. Take my friends out to eat, do some sort of something to like celebrate the good stuff. Even things like I just finished precepting this new grad and they're on their own now, like I trained them, or whatever the thing is, celebrate it, because there's also things that I have to like grieve the loss of, so making sure there's a balance of celebratory good things are still happening in the hospital, like this is still a good place to work, and not just so much sadness that I see. And then the other thing too, I take time to face the hard stuff, not just the good stuff. So I'm a huge podcast listener. I also host a podcast, but I listen to a lot of podcasts and music. Often on my way to work, I will do that. Very often, almost every time actually, my drive home is in silence. And I do that intentionally because I saw some rough stuff today. I'm a rapid response nurse. I show up when things are not going well. I see suffering. I see bad news being given. Like I'm with people who are passing. Like I see so much hardship. So on my drive home, I take time to think through, okay, yeah, that was really hard. I didn't like how that went. And just like take time to process the hard stuff and to kind of celebrate if good stuff still happened. Like I really connected with that patient. I'm so glad that I stood up and advocated for that patient, because it turned out, sure enough, they did have a big old aortic aneurysm, whatever. I like process my day. I face it and don't just drown it out with Netflix or alcohol or sleeping or whatever the thing. I actually face the hard stuff. For the most part, my drive home, my 20 minutes gives me enough chance to like work through it. But sometimes it doesn't. Sometimes I have to take time and like talk with my husband later, or call my work bestie, or take some time to like go get margaritas and queso with my best friend and like talk about the horrible patient that I cared for. Like sometimes there's more than just my drive home, but I've always taken time to face the hard things and not just like, drown them out with things that are soothing but not actually helpful. What else did I do? I love learning. I think that keeps things alive. So I am constantly consuming more information about nursing. I listen to so many podcasts. I'm subscribed to so many journals. I go to a bunch of conferences. I love learning new things, because then I'm like, ooh, I know this now. I want to use it. And then I get excited to like catch that patient with that weird diagnosis, or recognize those symptoms that mean the patient's developing this, complication. Like I love being able to put into practice things I'm learning. And so I think like constantly learning new things, not just the minimum required to renew your license, but on top of that, I think that's also helped me be excited about being a nurse. And then I think the final thing, I am not the person that's going to just be like griping about this is terrible, everyone's terrible, staffing's terrible, the patients are terrible. I want to find a way to fix it. So I find myself on committees and being a part of things that are trying to like make a difference. And those are like slow results. And the ADHD in me does not enjoy the slow results where it's like meeting after meeting after meeting to finally get the end result that I'm wanting. But when you finally do see that policy change make things better for the staff, or when they finally do like roll out education that like people are going to do it right now, it's very rewarding, and that makes me less prone to burnout when I see that good is still happening and change is still occurring. So those are some. I could probably talk for hours. I don't know if this is the direction you wanted to go with
Yeah.
your podcast
Yeah.
about.
No, I mean,
Yeah.
it's definitely useful to our audience, especially because I think that's something that we're seeing so much of is the burnout. So I mean, we will shift, but that was definitely, I
Yeah.
mean,
Well,
well,
and
it's
me and
you
Colin,
know,
we have an ongoing debate over what causes burnout. I always think it's more financially based. Colin kind of sides on the more like admin and just, I don't know, wanting to help too many things at one time. Um, I might be changing my mind a little bit, but I still, I still feel like it's financially based for most people.
I push back on that a little bit because the financially based stuff, like at the height of COVID, nurses were making more than ever and they were still leaving the bedside in droves. And so we were getting, I mean, I got paid really well at COVID. If I picked up extra shifts, I was making like an extra 150 an hour. It was like bukus of dollars, but I could feel myself on the brink of burnout so much more because it was so much more taxing and staffing was worse, and patients were, that load was heavier. Like there were so many things that lead to burnout. So yeah, I'm sure if you don't feel like you're getting paid well, I'm sure that contributes, but I think it's a lot more than just finances, because people get paid well and they still leave nursing and go do something that makes money in a much less stressful environment.
well, and you talked about new grads and precepting new grads, and that's one of the things that I've seen that's kind of been upsetting in the hospital is like the attitude that some of the older nurses or the more veteran nurses have towards new grads, like, oh, like they're wasting my time or they're in the way. And like I've always been very I guess I've always had a bit of a soft spot for new grads, so I always try and take them under my wing and help them out, just be kind of cool with them. But it kind of goes back to this overall culture, which I also think leads to burnout of just not, I don't want to say there's a lot of negativity in nursing, but there can be a lot of negativity in nursing. And to me, I think that's what plays into some of the burnout as well. I mean, do you feel like you see a lot of that in the hospital still?
I mean, I do think the culture is shifting a little better than whenever I started as a new grad, as far as like, guys, the whole idea of like nurses eat their young was just an accepted, that's just how it is when I became a nurse. And now people are like, no, nurses don't eat their young, you jerk. Like, no, that's not how we talk to each other. But there's still going to be those bad apples in every department that just, I those people, I have a lot to say to them, and I do say a lot to them because I have no tolerance for people who are making nurses feel stupid for asking questions. Like, how do you expect to fix the nursing shortage if you make them all leave because you're such a jerk? Like, you are contributing to the suffering of the whole profession by being such a jerk to this new grad. So I'm with you. Take them under your wing, make them feel supported, make them feel appreciated. No matter what question is asked of me, I always respond with, great question. Even if in my mind I'm like, pretty obvious. But I would never say that. I always say, great question, because you asked it. Every question that's asked is a good question because I want you to ask and feel safe to ask so you can do what's best for the patient. So yes, I'm with you, Colin. Let's take
Yeah.
him under our wing.
Yeah. Well, and I think the whole feeling safe to ask questions is so huge, because it's like if you keep beating them down every time they ask a dumb question, even if it is a dumb question, like if you beat them down, eventually they're not going to ask questions, and then they're just going to be winging it, and ultimately patient safety is at risk
Yeah,
in that
exactly.
situation. So,
Exactly.
and then you're not going to have a good coworker at the end of the day. Like
Right.
the more you build
Who
them
are you
up,
gonna
yeah.
fall on whenever you're drowning, right? The nurse that you wouldn't let ask any questions who's gonna do something wrong? Yeah, no, that's not what we want at all.
So you're still doing you said you built the rapid response team at your current hospital?
I did. So I had worked rapid response before at a different facility. And when I came to the hospital I work at now, it's about 550 beds. And if a rapid response was called, the ICU charge would have to leave the ICU and go respond to the emergency, which is kind of normal for most hospitals. But at COVID, that was like not cutting it because ICU is sicker, the floors are sicker. Like, why is the ICU charge having to be away from their unit for so many hours of the day? So I pitched the idea to our senior leadership. Can I please start a rapid response team? We clearly need one at our hospital. They said yes, but just you. You'll be the only sole rapid response nurse until you can prove your efficacy. So I collected a bunch of data and justified, clearly we're making a difference in patient outcomes. We actually cut code blues in half once we started a dedicated team. So they gave me more FTs, and I have a team of 10 that I lead. And so there's a dedicated nurse that responds to just emergencies. We don't have a team of patients we're looking after. We are just there to both respond to and also prevent emergencies in the facility by doing a bunch of proactive interventions as well. So yes, I started the team and I have the privilege of leading it. Just a little brag. Are you guys familiar with the AACN? Are you critical care nurses? Yes. Okay.
Yes.
So the AACN has the Beacon Award, and our rapid response team just received a Beacon Award last month, which we're really, really proud to say that we are a Beacon Award team, because that's a very hard, prestigious award to achieve. So we're really proud of what we've done.
Well, I was gonna just transition it to the podcast that we were kind of talking about earlier. So, so you said you kind of did it on a whim. You said that you kind of missed the education side of things and figured that podcasting was a good idea. I think before we started recording, you said that it was very sporadic, like once every few months or something.
Yeah, yeah.
So, what did I guess after you aired that first episode? Did you just kind of put it everywhere, YouTube audio, and then you just let it go? And then I guess what were the next few steps that made you even want to start doing it a little bit more full time?
So I think I recorded 3 episodes and then just released them like one every week. And then I was like, oh shit, I have to make another one. It is a lot of work to make a podcast, as you know. Like, it's not just like you
Oh
start
yeah.
talking to a microphone and you're done. I mean, there's like editing, and then you have to upload the audio file. I mean, it's a whole thing. And I realized how hard it is to do. But then when I started getting feedback from nurses at how helpful it was, I was like, man, I guess I should make some more then. But my first year as a podcaster, I made zero money on that thing. It was just a very, very expensive and time consuming hobby. But I felt like it was important work to be doing, and I loved doing it. And so, just like with any hobby, I don't know, skiing, it's pricey, but if you love it and you like getting good at it, then why not do more of it? And it actually helps other people. So that's kind of was my impetus to keep going past just the random episodes when I had a chance to do it and start being more consistent with it. As I learned about podcasting, I realized the opportunity there, not just to help other nurses, but also to free up more of my time to be with my family. And that was a big thing too, coming out of like the worst wave of COVID. I had worked a lot of hours, which also made it harder to find time to make a podcast. But as my schedule got back to normal a little bit, I realized, okay, so maybe I could work a little less at the hospital and have more time with my kids. So currently, I only work 2 12s a week. And then the rest of the time, I'm home working on podcast stuff. I have not just the podcast, but an online course that I sell as well. Then I have social media platforms that I, post stuff to. All that takes a lot of time. But the benefit is, even though I'm still taking time to do work, I'm doing it from my house, which means I get to be the one to drop my kids off at school. I get to be the one to pick them up. I get to make a good dinner, not just like something I'm throwing together last minute after my shift. I just have more time, even though it's like time I'm committing. The schedule is how I make it. If I want to record a podcast at 10 p.m., I can, or I could go 5 days and not do any work, and that's totally fine. And no one can tell me that I have to get up and go to the hospital. Like, I only work 2 days a week, so I do my 2 days, and the rest of the time is totally flexible. How much effort I put into making content, doing education, whatever. So I appreciate the flexibility, and it's given me a little side income to invest in things that are important to my family. So like taking trips to the mountains, and our minivan's on its last legs. We're gonna be buying a new car pretty soon, like all that kind of stuff. I'm not rich off the podcast by any means. Like, people say, oh my gosh, you have a podcast, you have 69,000 followers on Instagram, you must be rich, I'm like, no, have you seen me? I drive a 2011 minivan, guys. I'm not rich financially. I don't have a yacht. But I'm rich in the sense that I'm able to work 2 days a week at the hospital, and the rest I'm with my family. And we do have enough money to take vacations together, for my kids to have what they need. Like, I don't have the sense like, oh, I have to pick up extra shifts at the hospital and be away from my family to be able to provide for them. I don't have that stress. I still have the opportunity to go to the hospital and work and use my skills at the bedside, which I love doing. But for this season, I got 5 kids. I want to be around them. Maybe one day I'll work more 12-hour shifts at the hospital, but for right now, I want to be home with my kids. And the podcast has given me the opportunity to, meet their needs, meet my needs, but not be at the hospital so away from them as many days of the week.
As we've done this, we've been going a year now with our podcast. So we've had roughly, we were doing 2 a week for like a couple months. So we've done roughly 60 or so interviews. There's very few people that still love nursing and still want to do it. from the group that we've interviewed. I think the
We're also
trend.
targeting a different niche.
Well,
Yeah.
we're
Nurses
targeting
with
for
side
people.
hustles,
Yeah,
and
we're
there's
targeting
reasonable
people who
side
are
hustles.
looking for
Yeah.
things outside of nursing. But you've kind of found something outside of nursing, but obviously still love nursing. But I think it's just a testament to what those side hustles can create, because it's like, now that you have this option outside of nursing, it probably makes you like nursing even more, since you're not having to do it all the time. You're not burnt out. So it's great, it's great to hear that.
Yeah, for me, like my shifts that I work at the hospital, I'm like, ooh, it's like another chance to like put into practice the stuff that I've learned and to be with patients again. I've been spent so much time in my closet recording podcast episodes. I get to be with humans. This is great. So yes, I think the side hustle has been for me a good happy medium between getting to use my skills as a nurse and make a difference there. But I also feel like I'm making a difference in this, if you want to call it side hustle. And it is a hustle. I ain't gonna lie. This is not easy work by any means. It's different than the bedside, but there's a lot of time and energy commitment to have a podcast. But to me, it's rewarding in a different way, and it gives me that time freedom with my family. Makes it all worth it.
So for somebody, say somebody's listening and they want to start a podcast or something, and we've talked about this on ours also, but from your perspective, what would you tell them to expect as far as time commitment or energy commitment or anything before? And usually people want to start side hustles for money, for a little extra side income. What would you tell them? Would you tell them not to do it, or would you tell them to expect like 2 to 3 years before you see any form of payment? What would you tell them to expect if they were looking to start something like this?
I think it depends on your niche of the audience that you want to speak to. I had no intention or even realization that you could make money from podcasts when I started. And so for me, it was just a lot of content creation for the sake of creating it. Um, when it comes to podcasts, though, you have to decide, am I going to make money from something that I am selling, or am I going to make money from selling something for someone else? Selling something for someone else is easier. You just have to like say, do a little ad about their thing. um it's more work to create your own stuff and try to sell that. It also weighs heavier on you. I hate marketing my online course. I feel so cringy being like, please buy my course. But I had to tell myself, is this a course that's going to help a nurse? Heck yeah, it's going to help them. And everyone that takes it's like, this has been so valuable. So it's almost rude not to tell them about it. It's kind of what I have to like play tricks in my head about. So I decided long ago that I don't want to put too much effort into advertising for someone else. I would rather just advertise my own thing, because when it's my own thing, I can say with confidence, this is value. I made it myself. I poured my heart into it. This will help you as a nurse. You should buy this thing to make you a better nurse. I do some advertisements for other things, but let me tell you, I get hundreds per month of people that want me to sell their product, and I say no to it because I don't have the time or energy to review their product. It's not something that I'm passionate about, and so therefore I don't want to put the energy. I don't want to give my time up to sell someone else's product that I don't feel like is super important. That sounds so bad. It's fine if you want to do that to make money. That's totally fine. But for me, that's not what I wanted to do. So I have done some advertisements for like products that I feel like really help patients and improve patient outcomes, but I'm not over here like selling scrubs or earrings or I don't know, supplements. I mean, gosh, people selling supplements, they really want you to advertise for them. I get so many ads for supplements. Or not ads, requests to make an ad for their supplement. But that's just not what I feel called to do. That's not how I want to make money, so I've chosen not to do that. But if you want to make a podcast and sell other people's stuff, there is definitely opportunity to do that if you're willing to spend your time making ads about supplements.
Right. Well,
So
so we haven't done that yet, but we also want to be careful. Like we don't want to be an ad site, because then I think it cheapens the value of our listeners.
and like people come to my podcast to learn something, and so they probably don't want to hear me talking about how much I love my new underwear when they came here to learn about how to respond to a patient who's crashing, right? So that's just the stance that I've taken. But yes, there is opportunity to make money selling other people's products on a podcast. I just haven't gone that route personally.
Yeah, it's so hard to know what's real nowadays with all these ads on Instagram. And man, it is like, it's incredible. You click one thing and all of a sudden it's just like blasting you with
I know.
whatever that path is, and like the mushroom teas and all these things, and it's just like you just don't know what's real out there. As far as your podcast now, it started off sporadic. That was about 4 years ago. Now you're recording. How often are you recording? How often are you putting out episodes? And
Great question. I had been doing one per week, and that's a lot, as you guys well know how much work that is to do one per week. Um, I am currently in the process of transitioning to one every other week, I think. It's important to get your podcast like momentum to do it pretty frequently, but now that it's a pretty established podcast, it's consistently on the top of the charts for medical podcast at least. I'm gonna kind of back away and just do one every other week again, so to give me more time with my family. I think too, when it comes to podcast content, if you're just gonna do a podcast where you're like sharing your thoughts about politics or whatever, you can just turn on the mic and start talking and be done with it. But for my particular niche, I have to spend a lot of time researching every topic too. The idea of me sharing old dogma that I learned in nursing school on my podcast and misinforming people haunts me. And so I spend so much time for every episode, even ones that like I know forward and backward stroke. I could talk about stroke in my sleep, but I still take time to research every single episode, every single educational nugget that I share to make sure it is evidence-based, it is up to date, it's not misleading people. Because to me, that's really important. So again, my podcast takes a lot more time, I would say, than the average podcast just because of the research that goes into it. But if you just want to talk about, I don't even know what podcast, fashion and your opinions on it, then probably it wouldn't take as much research time than if you want to make sure that it's like evidence-based content that you are sharing with the world.
well, and then how do you, because that is, I think obviously what we're talking about is not as important in the sense of like people's lives aren't at risk if we give them bad advice. But I mean, that's definitely something that's been on our minds, is like, as we're sharing this stuff, it's like we don't want to mislead people. But in your case, how do you take these complex subjects and break them down for them to be applicable to new nurses, older nurses, everyone?
The way that I learn the easiest is to actually see it in real life, or to have some sort of case study to apply it to. Just like the random idea of DKA is a really hard concept to grasp. But once I saw a DKA patient, I was like, oh my gosh, look how they're breathing. Look at their lab values. Look, whenever I like, just to see the whole case evolve, it totally comes to life and I get it then. And so I decided to make the podcast very case study based. So every episode I share a real story to like kind of draw the listener in and to say, oh my gosh, what's wrong with that patient? How did you treat that? How did you know what to do? And then I get to, from the story, teach all the pathophysiology and the pharmacology. So for me, making the content interesting, engaging, applicable, easy to digest, for me means centering it around a story of a patient. That's how I learn best. So therefore that's how I teach as well. I also work really hard to not just use a bunch of medical jargon, but to try to like say the medical jargon and then explain it a little bit too. I have a lot of like silly ways to remember things, or like just ways that made sense in my mind. I share those as well. But to answer your question, I think the way I've made my content relatable and easy to digest is because it's based on a story and not just random me just talking for an hour about pathophys, which is like abstract in and of itself, but to apply it to the actual patient, I think makes it easier to digest, especially in the audio format of a podcast.
Like with everything you're doing now, obviously, like you said, you've been able to cut back on the working hours, so that's been able to allow you more time with your family. I'm sure initially it wasn't the case. So for somebody now starting out, what advice would you give them as far as like whatever their side hustle is? Not everybody's going to start a podcast, obviously, but for whatever they might be pursuing outside of nursing to supplement nursing, what would you recommend as far as finding that balance and being able to do both?
First off, I am not the expert here at work-life balance. I tend to sacrifice sleep in order to get stuff done because I'm so driven to do things well. So I'm not the best person to give that advice, but here's what I will say. I learned early on that I can be more productive and get more done if I'm willing for it not to be perfect. And sometimes that means passing some of the task off to someone else. So even though I want to have complete control of the podcast and edit it myself I'm actually maybe not the best person to do that. And so maybe like 2 years in, I hired an editor for the podcast because he actually knows what he's doing with audio formatting, and I don't even know what else he does. He fixes it and makes me sound so much better. I realized even though I don't have control over it, I'm passing off to someone else. he's probably gonna do a better job anyways and in better time. And to me, time is literally money. And so I would rather pay him money and maybe lose money, but I get more time to be with my family, to sleep, to take care of myself, and more headspace to think about the next podcast. About maybe 2 years in the podcast, I got really burned out on just the production aspect of it. I mean, I am not wired for that stuff. I'm an extrovert to the extreme. Sitting by myself in a closet, audio editing something, it was just not for me. I did it because I knew it was important, but I could not have done that sustainably long term. So choosing things that maybe you don't enjoy, that suck the life out of you, maybe you're not even good at, and passing them off to someone else and being willing for it not to be perfect anymore. But that to me has been maybe the best like business advice is you don't have to do it all, Sarah. You don't have to be in charge of all of it. You can delegate some of those tasks to somebody else. So I don't know what that means for you and your side business, but if your expertise is creating content, then do that and let someone else whose expertise is audio formatting maybe take care of that. I recently hired someone who does like social media graphics. I used to spend so much time in Canva just like making these educational graphics to go on with the podcast. And while I enjoyed the idea of having an educational graphic to post, I thought it was very valuable. Y'all, I would spend so much time like, what color should I choose? Which font is going to make this more clear? Should I put it on the left side or should I put it on the right side? I mean, just so much wasted time on these graphics. And I finally said, you know what? There's probably someone else who can do this better than me. Or maybe they can't, but at least it wouldn't be me spending hours making graphics that don't actually turn the needle in the right direction. So I recently hired someone who just makes me one social media graphic per week, and it has been money well spent. But a hard transition to pass that off to somebody else when I feel like I'm the best person to do it. But no, she actually does a great job.
That's kind of something that we experience also. So we also do do some real estate investing. We have this podcast, and it seems like every time we start making more money, we make another hire. So we're not really seeing all of this all of this extra money coming into our own pockets, but we do see our business building and growing, and it's rewarding to watch. But at the same time, it'd be nice to see some of that money also. So,
Yeah,
but
sure.
It's
we're getting a lot of our time back. To
time freedom. Yes.
So
yes. Yeah.
that's
also have
it.
some investment properties, and the first couple years that we had them, we just ran them ourselves. Like, we were the landlord. And so 10 p.m. they're calling my husband to come fix the toilet. On the weekend, he's over there, just constantly having to be the landlord. And while that allowed us to get all of that income from the rental properties, that means my husband is leaving at times when I really want him to be around. And so when I was pregnant with our last kid 6 years ago, I'm close to having the baby, and we're still getting these calls from people that want him to go change the outlet in their kitchen. And he was like, I can't be leaving to do this anymore. So that's when we made the decision. We're going to pass off the landlord responsibilities to a rental management company. Yes, we lose a good chunk of the income every month, but we get time for him to be available for his wife that's about to go into labor. And so I'm with you. Giving responsibilities to someone else, paying someone else is totally worth it. But don't think you're gonna be able to do that from the ground up. When you start something, you're gonna be the one hustling for a little bit. I think it's important to understand every aspect of the role of whatever the hustle is gonna be. But eventually, as it starts going well and you find you actually do enjoy this thing, and if it's something you're going to keep doing, then yeah, you can start passing things off to someone else and not taking sole responsibility for every aspect of the business.
Specifically with the real estate and the landlord stuff, it's the outlet that needs to be changed, the doorknob, or the cabinet thing. It's these people will reach out and it's oh, it's an emergency. It's that could literally wait a week, 2 weeks. Not that you want to, obviously as property managers, landlords, it's we want to take care of stuff, but it's we were talking to somebody recently who she was an NP, and she's I could literally wake up in the middle of the night, be on call, and just be yeah, this patient's crashing, give 9 units of blood and go back to sleep. But she was when we were doing property management, somebody calls about a broken toilet, and I'm panicking and freaking out. So it's just a different it's a different kind of thing, I guess. But are there any other kind of investments you're doing right now, or is it primarily the podcast and a little bit of real estate?
So for me personally, I'm doing the podcast and my education platform and trying to, make more content to help more nurses, and that will also pay for my kids' braces. My husband, however, so every house we've bought in the last 10 years, we have bought a fixer-upper and we have made it better, and then we rented it out, and then we bought a new house, and then we've done that multiple times. And so now we have one, two, three, four properties in addition to the house we currently live in, all of which the other four are being rented out. And so he still is the one that's like doing all of that. He has to deal with the taxes and like talking to their property management company. That's kind of his side hustle, if you want to say. And then we're currently trying to build up another chunk of cash so that we can do that again and buy another property. Just because it's not easy money. It's not easy, but one day it will be. You know, whenever we're retired and we have all these properties that someone else is paying us every month that are already paid off, then it will be easy money. But right now it's still work. And so that's kind of his thing. So I'm not the person to ask about how he runs that. I have no idea. He totally owns all of that. Just like if you asked him how to be a rapid response nurse, he would not be able to explain that to you either. So we each have our expertise. But yes, we are currently living in a fixer-upper. It's almost fixed up. We're getting there. And then eventually we're probably the same with this house as well. But he is a woodworker by trade, and so he has the skill set to actually fix the house and do it right. And so every house we lived in was not in good shape when we got it, and then we made it look beautiful, and now someone else gets to enjoy it, and that's kind of like his jam. So
That's great. And hopefully this next renter that takes your current home needs a podcast studio, because it's all good. It's all they're good to go.
very niche buyer's market right there.
Yeah.
Oh man. So we ask the same 5 questions for every guest. I think we're going to move on to that. The first question is, if you're going to educate yourself, and usually this has a financial, I guess, area of, it's a financial question, but if you want to use it for nursing, for new grad nurses, however you want to use it, it's just where do you go to educate yourself if you're looking to learn more about something?
YouTube is an option, but mind you, you're going to spend hours and hours finding the pearls amongst the trash on YouTube. So it is an option. I wouldn't say it's the best place to look. I have found the most value from finding someone who I feel like is an expert and seeking out their mentorship, either by paying them to teach me something or just by like straight up messaging somebody a question. I feel like you can learn a lot from people who have already gone where you are trying to go. And so, for example, people that are looking to do a side hustle should listen to podcasts like yours, because you guys actually have side hustles that are bringing income for your family. So YouTube's one way, but I feel like it's better to hear from actual people who are doing the work that you are hoping to do. And then, yeah, online courses, again, from people who have already done the thing that you're trying to accomplish. There is just a little, for my niche example, I have been asked recently to be a speaker, like a keynote speaker at conferences, which I'm like, what a great opportunity. And of course, they ask you, what's your availability and what is your fee? To which I was like, well, I don't know. What do y'all got good snacks? If you got good snacks, I'll come. You know, I don't know what to charge
Pizza.
to be a public speaker. And so of course you YouTube it or you Google it, you're going to get a wide range of misinformation. And so I just straight up messaged a woman who is a well-known nursing educator and asked her, what do you charge? Obviously, I wasn't going to charge what you charge. You've been doing this for a long time, but like, what is a range that you should be charging to be a public speaker? And when she told me the range, I was like, are you freaking kidding me? I can charge that much money to talk about being a nurse, which I would do for free? Shoot, yes, I will do that. And so, yeah, so just reaching out and asking people questions is how I have learned not to just say, I'll come for free as long as you feed me. Instead, I said, I charge X amount to be a public speaker. And then now I get to use that money, again, to replace my minivan with a car that's not on his last leg. So, yes, so seeking out mentors to me is more valuable than hours and hours and hours and hours on free YouTube. And sometimes you have to pay for that mentorship, which to me is worth the investment.
I don't know. You kind of already. Well, anyways, this might be different advice, but what advice would you give yourself as a new grad?
I would say, Sarah, this is something that you want to do for the long term. Like, you love this, you were called to this, so you need to find ways to make it sustainable long term. And that's going to mean saying no. And if you find yourself getting jaded or getting frustrated or getting irritable or like, you know, going along with the crowd as far as like the negative approach towards patient care, find new people to be around, find a new environment, find ways to fill up your cup so you can still operate out of wholeness and not just like get caught up in the wave of negativity, because that wave is going to lead you to burnout. So I think that's the advice I would give a new grad.
All right. Third question is, what excites you about the next 12 months?
minivan.
Next 12 months. Yeah.
The new minivan.
So yes, I'm excited about getting a new car, but that's so like that's really not that's something I'm super excited about. That's just a small aspect of my life. The next 12 months, my son's graduating high school, and so I get to be with him for that experience, prom, and all of those things. My other daughter, she's about to start nursing school. She's 19, so getting to walk with her through the experience of being in nursing school and supporting her through that. My other son is really getting into acting, and so getting to like go to all of his plays and just like beaming with pride at his skill set. I mean, all my kids are doing something great in this season of life, so just getting to walk with them through that. Um, and then, another year with my husband. I married a freaking saint, and I just love spending time with him. And so I hope that in the coming year, I'll have more opportunity to like go on trips with him and spend time together, figuring out what it is we're to be doing in the world together. So I don't know. There's not one thing I'm excited about, but most of it involves just being with the people that I love and walking and doing life with them.
So the fourth question is, how do you define success?
Success for me is where what my heart wants is aligning with how I'm spending my time. So whatever that means. So if my heart wants to spend time with my family, when my time spent actually lines up with that. It's not the deepest answer, but
No, that's great.
I was gonna say, I think
Yeah.
that
Deep
like, there's
enough.
no like bank account number or
No,
list
that's
of things that I
Yeah.
would own that would mean success for me. And I don't even have like a time allotment that I could give you. But if what I want is actually what I'm doing, that to me is a life that's successful. That's what I hope for my kids as well.
That's why we love that questions, because there's so many different ways that people define success, and I actually find it to be a lot less about money than what I used to think. Like most people that answer that question say nothing about finances. What's the biggest mistake you've ever made, and what can we all learn from it?
I think the biggest mistake I've made was not just a one-time thing, but my approval addiction and wanting people to like me, and how that influenced so many of my decisions of how I spent my time and my money and my energy, like my thoughts. Being so worried what people think, the people pleasing was a huge mistake. And I think as I've gotten older, I'm 40 now, I have come to realize that not everyone has to like me. In fact, I get to choose who I care about, like who I care what they think. People say like, "Oh, I don't care what people think." Yes, you do. Either you're a liar or a psychopath, but everyone cares what people think. I just have learned like, okay, I don't care about what that person thinks or that person. But like my husband, for example, I care deeply about what he thinks about me. My boss, Brian, I respect so much. I care what he thinks about me. My kids, there are people I care what they think. And I will spend time being the best person for that person in my life. But some people, the doctor who doesn't care about the patient and also doesn't care about me, I also don't care what he thinks of me. And I'm just going to advocate until I get what I need for my patient. So my biggest mistake is worrying what people think and letting that drive my decisions. And I think I've learned, so not perfect, but I've learned to let go of my approval addiction. I would say I'm a recovering approval addict, still working on it.
it's hard to let that one go. But well, this has been great. If people are interested in checking out the podcast and seeing what you're doing, where can people find you?
My podcast is on all podcast platforms. It's called Rapid Response RN because that's what I do every day is a Rapid Response RN. And then on all social media platforms, I am the Rapid Response RN because Rapid Response RN was already taken. I had to add the "the" to make it a special. So yeah, the Rapid Response RN on social media if you wanted to find me.
That's all right. It sounds more official that way, anyway, so it's good.
I'm gonna make a new one. It's gonna be the real rapid response. All right. Just kidding. All right. Well, great.
Yeah.
Thanks again for coming on.